All right. Well, we are going to go ahead and get started. I appreciate you guys being here with me today. Um, Annette, thank you for responding. I guess our sound is working, so we're going to go ahead and let's just get going. I'll introduce myself. My name is Dr. Brady Wyrick. I appreciate you guys again being here for me today. I am the clinical director of Intermountain Regenerative Medicine. We have our main offices in Idaho Falls, Idaho, and then our secondary office is in Bountiful, Utah. So what we're going to do is we're going to start off by just going through a couple things, going through our disclaimer first and foremost. As we go through this, we're going to take, webinars. People say that webinars should last no more than about 30 minutes. And for me to get through this information in 30 minutes is very, very difficult. So what I'll do is, as we go through this, you're going to have questions. I understand that. I get that. But I'm going to ask you just to hang on to those questions until the very, very end. The reason for that is I think we've done a good job of putting this webinar together, and we will answer most of your questions just as a natural process of the webinar itself. So if you can just hang on to those for me, I appreciate that. But here's the disclaimer. Number one, we're here for educational purposes only. Okay? This is not going to be a sales pitch. This is not going to be a high pressure type of thing. But to be clear, up in the comments, you're going to see a link to Calendly. There's a link there that says Intermountain Regenerative Medicine /webinar consult. That's a link that you can click, and I think that there's a button there as well too that says you can book your consult. What we are offering is, if you hang with me till the end of this, and if what I say makes sense to you, I'm going to ask you to click on that link, because what you can do with that link is you can actually book a one-on-one consult with me so that we can talk about your condition specifically. This is a one-on-one. This is a phone consult, so that you and I just get on the phone and just discuss your case individually. That way we can go through, we can answer those specific questions, we can talk about whether or not this is a right fit for you, if what you're hoping to accomplish is reasonable, etc. You can do that by clicking on that link or on that button itself. Now, but this is an educational purpose only. I'm not here to tell you that stem cells are going to treat anything. I'm not here. I just want to share with you what the latest science says. Right? Second thing is, stem cell therapy is not approved by the FDA. And I think by the time most people get here, they already understand. The FDA still calls this quote unquote unproven, even though there's a mounting amount of evidence, both clinically and in research studies that are saying, hey, this is a viable thing. This is where medicine is going. My opinion is this is the future of medicine. Okay. Second thing, well, again, with that second thing, because the FDA doesn't approve it, that means that insurance companies, Medicare, Medicaid, et cetera, they're not going to cover it, but we will discuss exactly what the costs are before the end of this webinar. So the third thing is, Intermountain Regenerative Medicine is a medically integrated clinic. That means we have a medical staff. We have medical directors. We have nurse practitioners. Myself, my background is in chiropractic and functional neurology. I practiced functional neurology and functional medicine for about 14 years before I started looking into what stem cells were doing and where the direction of regenerative medicine was going. So that's when I got into this about a year and a half ago. But really, my job in this is education only. I'm not the one doing the injections. We have nurse practitioners that are very, very skilled to do that for us. And lastly, we utilize stem cells that are derived from donated umbilical cords. Every single time we do an ad on Facebook, for example, someone gets in there and gets all fired up about using stem cells that are coming from aborted babies, and it's just not true. These cells come from healthy moms, healthy babies. They've consented to donate their cords. Their cords go through a process that is overwatched by the FDA to make sure that they're clean, that they're safe, that they're not going to do any harm, and that they're viable. So we're not using them from dead babies. Can we make that absolutely 100% clear? These cells come from donated umbilical cords from healthy moms and healthy babies. And somewhere around here, I've got a glass of water. There it is. Okay, so that is the disclaimer. Now that we got that out of the way, we can jump into the meats and potatoes of this. So what I would normally do, if we were doing this as a live workshop, we would take a few minutes here and go through the stories of our patients and what they've done and how, and the success stories that we've seen. I'm not going to do that with the webinar just because the pure sake of time. If you go to my website, which is here, I'll go ahead and put this up there, iamregen.com. You can see these stories. If you go to my YouTube page, if you search for my name on YouTube, you're going to see all sorts of testimonial stories such as these. They're all there. I'm not going to spend the time to go through these, but you can search those out if you like. But what we want to talk about really is we want to talk about what stem cells are. We want to talk about what they're used for, how they're applied, and how they work, etc. So that's the direction that we're going to go. Let's start off by talking about this. What is a stem cell? Now, the definition that I love to give was actually given to me from a patient of mine. And he called stem cells a blank slate cell. And I thought that was absolutely genius. Now, if you think about a blank slate, what is it? A blank slate, if you think about a white sheet of paper, that is a blank slate that you can literally do anything with. Hey, so right now, inside of your bone marrow, inside of your blood vessels, inside of your fat tissue are these blank slate cells. And your body will use those blank slate cells when it gets injured, when it gets under stress. Those cells will be released to go to the site of whatever that injury is and become what that tissue needs to become. Now, what most people don't realize is that you started your mortal life as one single stem cell. So when your mom's egg was fertilized by your dad's sperm, you became a single stem cell. Hey, that was a totipotent stem cell is the scientific term for it. But that one stem cell was literally the derivative of every single cell that's inside of your body. Hey, now when you're born, so that stem cell, those are totipotent stem cells, and they last up until about 2 weeks after conception. Then they become embryonic stem cells up until you're born. Embryonic stem cells, by the way, are a no-go as far as using them for stem cell treatment. I think I've already made that clear, but I'm going to point it out again. Then once you're born, once those cells are inside of your umbilical cord, they actually become adult stem cells, and that's really what we're talking about today, are these adult stem cells. I know it's kind of confusing because it's coming from a baby's umbilical cord, yet it's an adult. It's an adult stem cell. So those stem cells, I love this. Check this study. I think it's pretty cool. Stem cell paracrine actions in tissue regeneration. This is from PubMed.com. It says stem cells have emerged as the key element of regenerative medicine therapies due to their inherent ability to differentiate into a variety of cell phenotypes, thereby providing numerous potential cell therapies to treat an array of degenerative diseases and traumatic injuries. So in English, this is what that means. I think it's this chart right here. Those cells, those stem cells have emerged because they can turn into and help with a lot of different stuff. So on this chart up here, you have a mesenchymal stem cell, adult stem cell, kind of interchangeable terms in my book. Mesenchymal stem cells, when you get injured in the muscle, for example, they can go and become muscle. Okay? When you get injured in your bone marrow, in your marrow, they can become marrow. If you get injured in your cartilage, they can become cartilage. And if you put this into real terms, when you get injured in your meniscus of your knee, and we put those stem cells into your knee, guess what they become? They can actually become new meniscus. Okay? That's why tendons, if you tear a tendon, you can help these stem cells become new tendons. So I hope that makes sense. But this is the blank slate up here. These are the things that they have a chance of becoming. And this is why they're so helpful in things like osteoarthritic joints, which we're going to spend quite a bit of time talking about. So people will ask me at this point, well, if I've got all these stem cells, then why won't my body recover? And here's the answer. When you're born, you have a tremendous amount of stem cells. 1 out of every 10,000 cells inside of your bone marrow is an actual stem cell. And as you age, that number drops off drastically. I know my video is covering my numbers up right here. That's 1 out of every 2 million. But these cells, they literally just drop off as you age. So if you think about it, why would a newborn baby need so many stem cells? Well, they need to go from this big to this big just to survive. So, and as you think about teenagers, why is it that teenagers can stay up late playing video games, eat garbage, and destroy themselves playing sports and not sleep enough and then wake up and do it all again the next day? It's because they have a lot of stem cells. But you get out here at the age of 80 and 1 out of every 2 million cells is a stem cell. You think about, why does an 80-year-old person get those injuries on their arm that don't heal for a long time? It's because they just don't have as many stem cells. The other issue at play is that those stem cells that they have don't replicate as fast as they used to. So here at birth, our cells replicate every 28 hours. That means it takes 28 hours for one cell to become 2. Hey, you get out here to the age of 65, for example, that number drops all the way down to 60 hours. So it takes more than 2.5 days for that cell to replicate when you're older. Okay? So these webinars are hard because I can't see you and I can't see feedback and I can't feed off your energy as well. So if you think about it, hey, let's say that this blue piece coming across the screen here, this blue structure is a healthy tendon or a healthy ligament. And as we age, that ligament gets injured and starts to break down. Hey, and as it starts to break down, we go into the doctor because our joints hurt. Hey, the number one thing that we can help with stem cells is osteoarthritic joints, especially in these big encapsulated joints like the knees, the hips, and the shoulders, etc. So as that tissue breaks down, you go into the doctor. Well, let me back up. I'm ahead of myself here. When our joints start to hurt, what do? We will typically go to the medicine cabinet and get some ibuprofen or some Aleve or something over the counter, and we'll start taking anti-inflammatories to help with the pain. Does it help? Absolutely. Is that a bad thing? No, it's not. But over the long term, what happens? Hey, those medications stop working. We end up going to the doctor. The doctor takes an x-ray that may look like something like this, where this is actually a 54-year-old male that walked into a friend of mine's office. Hey, at the time of this x-ray, the space between the top part of the knee and the bottom part of the knee was 2.8 millimeters, otherwise known as bone on bone. So that space being bone on bone, hey, that is an osteoarthritic joint. So when your x-ray looks like that, what are your options? Hey, you can do steroid injections. They do help with the inflammation, but you can't do them long term because they actually break the joint down. You can do physical therapy. Very, very helpful. That's a good thing. But the doctor will literally tell you, if you haven't heard this already, deal with it. Hey, the medications are typically lifelong, by the way. And when those steroid injections stop working, you will hear something along the lines of, well, let's wait until you can't walk anymore, or you can't sleep, or both, then we'll replace that joint. Does that sound familiar? Hey, but what we're talking about now is, instead of doing something as drastic as a replacement surgery, what if we could come into the joint space on this side and release stem cells from donated umbilical cords into that joint space? Now, what will those stem cells do? Here it is. Hey, I hope you have a pen with you. Number one, in fact, you know what? Here's what I'm going to do. I'm just going to type them out here for you. Number one, they are anti-inflammatory. They're going to go into that joint space and start knocking the inflammation down. Hey, let me tell you a quick story about my dad. He was one of the very first patients that we injected. He was scheduled to have both of his knees replaced, and he was 71 at the time. So we did this injection for him on both of his knees, And because of the anti-inflammatory effect, and some say it's placebo, and I'm okay with that because placebo still helps you feel better. But because of that effect, he was one of the very few patients that actually got up off the table and felt better the moment after the injection. It does happen. It's happened in a small amount of cases. Now, to be clear, most people are going to see a result between 6 to 8 weeks out. It's not going to happen right away like it did for my dad, but it does happen. So he started feeling a result right away because of the anti-inflammatory effect. Okay, the second thing they're going to do is they modulate the immune system. And let me spell this out for you. The reason why the reason why steroids work is because they're such powerful anti-inflammatories, but they suppress your immune system, meaning they bring all of the immune system down, and that leaves you susceptible to secondary infections. Well, if you modulate the immune system, that means you upregulate the part that keeps you from getting sick, and you downregulate the inflammatory portion. And then third thing they're going to do is they're going to start to regenerate and regrow tissue. So in this particular case that I'm showing you here, okay, this is when you inject into that joint space and those cells go in and they start replicating every 28 hours like we talked about, what they're going to do is this represents the right here, HCTP, that's human cell and tissue product, otherwise known as stem cells. Those stem cells will start releasing all of these growth factors and anti-inflammatory factors and regenerative factors that start filling up those gaps, that start regenerating that new tissue. And then all of a sudden, 4 weeks after the injection, that space goes from 2.8 millimeters to 5.3 millimeters in just 4 weeks' time. That means they're regenerating, they're regrowing new cartilage. Okay? And you bump forward and this continues to go on, and you get to 8 weeks after the injection, that space has gone to 6.1 millimeters. Why? The reason why is because those cells are replicating at a rate of every 28 hours to regenerate and regrow new tissue. Okay, so this is what the x-rays look like if you compare them side by side. This was 2.8 millimeters, this was 5.3, this is 6.1. Okay, this is an 8-week difference. So this is what it looks like on x-ray. Here's what it looks like in the papers. Hey, this is an interarticular injection of mesenchymal stem cells for the treatment of osteoarthritis of the knee, a proof of concept trial. So they took 18 patients, they injected into their osteoarthritic knees, and look what happens. The size of the cartilage defect decreases while the volume of the cartilage increased, meaning the injury decreased, but the volume increased. They actually grew new tissue. Now, if we were at one of my live workshops, what I would do now is I would actually show you a quick video of my dad about 5 weeks after his injection, actually pedaling his bike, because he's growing new tissue, he's growing new cushion inside of those knees, he's growing new cartilage. We'll talk about how long that lasts here in just a moment. But first, I want to talk just briefly about the history of regenerative medicine, kind of where it came from. I'm going to do this with this chart. I don't know if you guys can see the cursor on my mouse or not. I don't think you can, but I'm sitting here circling everything like you can. Okay, so over here on the left where it says pharmaceuticals, pharma, okay, the pharmaceutical industry, when it comes to offering us things that can help regrow and regenerate new tissue, they don't have much to offer. Yeah, there's medications out there that can help us with general cytokines to maybe stimulate some growth, but they really don't have a lot. So where it started is with peripheral blood, with PRP, platelet-rich plasma. Hey, PRP is awesome, and we're actually looking at doing some PRP in our office in conjunction with our stem cell therapy for the pure reason of just getting all of these growth factors in there so that people can basically what it will do is it'll help us fill the gap. Most people will see a difference between 6 to 8 weeks, but when you do PRP therapy, it can come on a lot quicker, but it doesn't last as long. Because I can't talk today. The reason why it doesn't last as long is because there's no stem cells inside of PRP. So you don't get that regenerative effect. You can get your own stem cells to be stimulated. Remember, your own stem cells, you are limited by how old you are. So PRP alone as a standalone may not be the best option for you if you're older. But if you take PRP and combine it with stem cell therapy, then it gives us a lot bigger opportunity to help you quicker and more long term. So PRP is where it started. Again, I'm a big fan of PRP. I think it's awesome. From PRP, we went to something called autologous stem cell therapy, which is over here on the right of your screen, where we started using bone marrow and adipose tissue. Adipose is fat. A bone marrow, it means you have to, when you use bone marrow stem cells, you do have to harvest them. So there's a procedure that they'll do to drill into your hip, and they'll pull out the bone marrow and they'll harvest the cells from your own bone marrow. Adipose tissue, using adipose tissue stem cells requires you to do a little bit of liposuction so you can take them from the fat tissue. Look, this is stem cell therapy. You do get you get stem cells by doing this, and you get live stem cells by doing this. And you're getting your own stem cells by doing this. But the problem is that you're limited by your age. The stem cells that you're getting aren't as robust as they used to. You don't have as many of them. They have higher inflammatory factors. I could go on and on and on, but here's the reality. Hey, if you want to do autologous stem cell therapy, I welcome you to do that. Please go do it, because I think it's better than anything the pharmaceutical industry has to offer us. However, if you use your own stem cells, you will spend more money doing this, and it's not going to be as effective because you're limited by your age. Okay, so that's what we call autologous stem cell therapy. Allogenic stem cell therapy means they're coming from you. Excuse me if I said that wrong. They're coming from a donor. So the donor cells started coming from the placenta, and then we realized that the placenta had a lot of the growth factors and cytokines and other things that you needed, but they did not have a high mesenchymal stem cell count. So they were helping people short term feel better, but it wasn't lasting because there wasn't cells in there that were regenerating. That takes us to the umbilical cord. The umbilical cord matrix, you'll see over here on the right column under umbilical cord. This is called, the matrix itself is called Wharton's jelly. So if you looked at a cross section of the umbilical cord, you'd see two arteries and a vein coming through like this, and all the surrounding tissue would have this Wharton's jelly in there, and that's the highest count or the highest source of mesenchymal stem cells that we know about to date comes from that particular cord. And you think about anatomy and you think about pregnancy and embryology, it's actually a really cool thing, because when your mom gets pregnant, you know, that baby is basically a foreign invader, and by all accounts, her immune system should go after and attack that foreign invader and not allow that to happen. But that doesn't happen because the barrier between the mom and the baby is that umbilical cord, and it's just lined with these mesenchymal stem cells that are helping control that immune system reaction. I think that's really cool. And the fact that we have the technology that we can get those stem cells and safely harvest them and cryogenically freeze them and then re-inject them into patients while they're, it's just, the technology just blows my mind. It just, sorry, I get really excited about it. So that's where these stem cells are coming from. It's coming from the umbilical cord, because that is the youngest life source that we know about. And that's why we use the umbilical cord cells, and we're starting to use some PRP in conjunction with that to cover that gap so that we get quicker results that last a long time. It helps us cover that entire spectrum. So next up is what other conditions can they help with? I know some of you are on this webinar today going, well, what about this? What about that? Here's what I will tell you. Look back at the three things that stem cells do. Number one, they're anti-inflammatory. Number two, they modulate your immune system. And number three, they regenerate, regrow new tissue. Most of the people that come to me that don't have an osteoarthritic joint will have a condition that goes through those three things. And this guy here was absolutely no exception to that. This is George, and that is psoriasis on his knee. So this is the day, the top picture is the day of his infusion. And when I talked with George, I basically said the same thing I'm going to say to you when we do this consult. And that is, what's your number one goal? And clearly his number one goal was this psoriatic issue. And I told him, I said, you know, I wish this was an osteoarthritic joint that's where we have the highest, our osteoarthritic cases, our success rate with otherwise healthy people climbs over 90%. And George was not an osteoarthritic case. And I just said, George, look, here's the deal. Here's the worst thing that can happen with your case. The worst thing that can happen is nothing. Meaning, we inject you with these stem cells, and the worst possible outcome for you is going to be nothing happens. And if you can afford to take that risk, then take it. If you can't afford it, then don't. Okay? And we discussed what the cost was for George, and he proceeded forward. And it's a good thing he did, because 14 weeks after his injection, the bottom picture shows what his knees looked like after the injection. Now, there's about 6,500 studies going on worldwide right now. There's an awful lot of them going on in the United States. We're trying to push this to the front of medicine in general. Hey, there's a lot of studies that can be found. PubMed.gov is a great place to find them. This is just one particular one that we did in our office that was pretty cool. So if we're going to talk about something other than osteoarthritis, that's the conversation that we're going to have is, hey, look, this is what happens. It may do nothing. It may be a miracle for you. We just don't know until we try. So that was George's particular case. So what else can they help with? Yeah, we've seen a lot of people with autoimmune issues that it's helped with them, but we're not going to make any promises there. So here's a great study that I came across: human umbilical cord mesenchymal stem cell therapy for patients with active rheumatoid arthritis for safety and efficacy. They do point out in the study that it was safe, but up here the treatment induces significant remission of disease according to the American College of Rheumatology Improvement Criteria, the 28 Joint Disease Activity Score, and the health assessment questionnaire. So yeah, there are some things that it can help with autoimmune conditions. We've seen people do really well with it. We've seen people that it didn't help at all. Again, just as long as you understand what the risk is, and the risk being, if it's not an osteoarthritic case, it may help, it may not help. We'll discuss that when we do your consultation. So a couple of just basic questions that I get asked all the time. Does it hurt? This is my dad. Actually, on his injection day, this was Mike, our nurse practitioner. Does it hurt? And the answer to that question, is you are getting a needle. It does require penetrating the skin, and that can hurt and has some minor risks that are involved with it because you're taking a needle. Now, we use a little ethylene glycol on the joint before it's injected. I've had 80-year-old women tell me they didn't feel a thing. But does it hurt? Yeah, it can. Our nurse practitioner, I think they're very, very skilled. They do their best to minimize how much it hurts. And typically what will happen is the day of your injection, for about 48 hours after that injection, that joint can swell and feel like it's hot and feel like it's full of fluid because we just introduced new fluid into it. So it is quite common for people to feel a little bit more pain 48 hours after their injection. And then for most people, they'll feel about 6 to 8 weeks is when they feel the difference. And that's really when we're going to have a follow-up with you, is about 6 to 8 week mark, because we want to know how you're doing. To me, how long it will last depends upon you. Hey, there are studies out there that suggest that they can last anywhere from 5 to 7 years out to 10 to 15 years with studies that aren't done in this country. But to me, how long it will last depends on you. And the scenario that I talk about is if we do this injection and you grow new cartilage in your knee or your shoulder or your hip or whatever, if you don't take care of that joint, you don't take care of yourself, chances are your body will break that one down as well. And so it may not last as long as for you if you don't take care of yourself. So when you ask me how long it'll last, I will say that, hey, here are these studies that suggest this. However, everybody's different. We just don't know at this point, but it could be 5 to 7 years. So we don't have a whole lot of people that come back. We've had a few. For my dad, his injection was about 1.5 years ago. He's still doing remarkably well. And I don't see that stopping anytime in the future. But everybody's different as far as how long it'll last. So is stem cell therapy right for you? And here's the 3 questions that we ask. Number 1, what's your overall health status? So when we do this consultation, we're going to ask you, how tall are you? How much do you weigh? What type of medications you're taking? Okay, because if your body mass index matters, all right, if your height and weight matters, the number of diseases that you have matters. I said earlier, if you give me an otherwise healthy person with an osteoarthritic joint, our success rate is going to go over 90%, meaning you get a 90% chance of this being a very good thing for you. But if you're taking a whole bunch of drugs, you're 100 pounds overweight, you're inactive, and you've got all these diseases on top of that, guess what? It may not happen. It may not work for you. And that's why I'm really big on, hey, let's just sit down and talk. Oh, by the way, I don't think I've said this yet. That consultation is not going to cost you anything. We just want to talk and see where you're at. Your mental mindset's a big deal. If you're coming into this, you've been with me now for about 34 minutes. If you're coming into this going, oh, well, this is a waste of time, this is a waste of money, well, guess what it's going to be for you? A waste of time and money. But if you come into it going with what we call hopeful optimism, saying, okay, this could be a very, very good thing. If it doesn't work, it doesn't work. But if it does, awesome. That's more of the mental mindset that's going to be beneficial for you. The last part of it is the financial part of it. And as I said before, I hinted at this before, if you can't afford to do it, don't do it, because we understand that it's expensive. So 1 cc. So think about, here's what it costs. Okay. Once they're done in cc increments. So if you take 1 cc, you can use 1 cc of these stem cells, and that's 1.1 million live cells. You can do that with one joint, like a big joint, like your shoulders, your hips, your knees, etc. Or you can do this with the back as well, back and the neck. 1 cc is one joint is $4,250. Hey, if we do 2 joints, it's $6,750. 3 joints, it's $9,250. We understand that it's not cheap. We get that. So when we do this consultation, we're going to discuss that. Because if you can't afford it and you spend your last dollar on it, guess what's going to happen to your stress levels? Your stress levels are going to shoot up. And if they shoot up, that decreases our chances of this working. So that's why we want to have a very frank conversation about what it costs, what's going to go best for you. Now, here's another question I get all the time. Can we do one joint now to see if it works and then come back and do another one later? Absolutely, we can. It's not going to be a $2,500 difference. It's going to be a little more, but you can do it that way. Now, payment options are cash, check, or credit card. You can use your health savings account. You can use your flex spending account. We do have some financing options that are available. I need to take off that OAC. We have some that work off of credit. We have some that don't. But there is some financing options available if you want to do this, making some payments. So that's how much it costs. This is the financial options that are available. So that takes us to the question is what's next? You got 2 options at the top of the message. So you'll see that link that says calendly.com/Intermountain Regenerative Medicine's webinar consult. If you click on that link, it's going to take you to my calendar where you can actually schedule this consultation so that we can just talk over the phone. Again, that consultation is not going to cost you anything to do it. Let's just get you on the schedule. Let's just talk about what's going to be the best option for you. When you schedule that, you will get an email that will have a link in there that you can go in and you can fill out the paperwork based on that link. Now, I think there's also, I'm still new to the whole webinar game, so excuse me. I think there's also an offer button that you can see that says click here to book. If you click on that, that will also take you to that same Calendly page. I think. I guess we better double check it. Yeah, I just clicked on it. It goes to the other link. So you can click there to book it as well. But again, it's not going to cost you anything to do that, to do the consult. What we're going to do is we're going to talk about your areas of degeneration. We're going to talk about strategies. Are we going to do this into the muscle or into the joint itself? We'll talk about your cost options. This one's huge to me because I know you've got other questions that we just haven't gotten to, but I want to make sure all of your questions are answered, and then make sure your spouse is involved if you have one. Scheduling and timing is a big deal because scheduling and timing right now, our injections are about 4 weeks out. That means that 4 weeks is the minimum time that we can use to get you in to actually do the injection. But then you got to consider it's going to be 6 to 8 weeks after that before you feel the biggest difference. So we want to talk about what's the schedule that works best for you. Hey, what is it that it's going to be? This is on what's best for you and your family, not what's best for me and mine. But we want to get you on that schedule to do this when it's best for you. Hey, last thing, if you go through it this way and if you book it this way, we are going to give you a $400 voucher. So that's going to give you $400 off your injection. That is, if you schedule it, go ahead and just go click on that link, get scheduled now. Number 2 is you got to keep that appointment. And then number 3 is got to use that voucher within 90 days. So, guys, I went through this. I went over a half an hour. It's been about 40 minutes. I appreciate you being here and joining me on this lovely Saturday. I'm going to leave that link up there. So if you'll go ahead and click on that link, let's get you scheduled. Let's get you on my calendar so we can just sit down and talk personally about what's happening with you.